Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Well, in Washoe County, there are nearly 60,000 people under age 65 who don't have health insurance. If a medical issue comes up, those people will have to turn somewhere for help if they can't pay out of pocket. And that's where my guest for this segment comes in. Peter Stanton with Care Chest of Sierra Nevada is here to talk about this issue. Peter, thank you so much for coming on the show.
Thanks for having me, Ariana.
Okay, so for people who aren't familiar with Care Chest, tell us what it does.
So Care Chest's mission is to provide free medical resources to Nevadans in need. We provide medical equipment and supplies, so stuff like walkers, wheelchairs, incontinence supplies, nebulizers, and a whole lot more. We provide prescription assistance, so helping people pay for emergency prescriptions when they're unable to. Diabetic supplies. We help people with medical nutrition, so products like Ensure and Glucerna. We have an independent living program that helps people make modifications to their homes and to their vehicles. We also do wellness education, so nutrition, exercise, that kind of stuff as well.
You guys are busy.
We are. It's a full suite of services, and we've never been busier. We served almost 13,000 people last year, and it's a need that we see continuing to grow in our community.
Yeah, now describe for me what the need is doing right now. I mean, are you seeing a big flood of people coming in saying, I'm not sure if I'm going to have health insurance and I want to, get my ducks in a row ahead of time, or what are you hearing from people?
So most of the people that we serve are folks who have been to the doctor or are facing an unexpected disability or diagnosis, something along those lines, who find themselves unable to afford the medical equipment that they need. So for a lot of folks that they are uninsured, a lot of people will find themselves without insurance when they are sick or when they are hurt and can no longer work. About 50% of our clients are between the ages of 30 and 65, so working age folks who are simply unable to obtain the medical resources they need. For a lot of people, a copay for their prescriptions is out of the question, much less coming up with $200 for a walker, $800 for a hospital bed, something like that.
Yeah, I mean, the costs skyrocket. I mean, it's expensive even if you have insurance, let alone without insurance. Most people probably haven't even seen that total cost if they do have insurance, right? But we're talking, I mean, thousands of dollars easily for some things that are pretty basic.
For pretty basic stuff, and it's a need that we see all of the time. I was coming back into the facility after lunch the other day, and this gentleman, he was probably in his late 40s, was kind of slumped over a bicycle in front of our facility, and I asked him what's going on. He says he has COPD, he biked 4 or 5 miles to get to our facility to get a nebulizer.
Oh my goodness.
Right, and so that's the extent of the need that we're talking about, and how badly people want these services and are willing to, the lengths they're willing to go to get them. And so to be able to look somebody like that in the eyes and say, you may have been told no at every turn by insurance or by, a doctor or by Medicaid, but we're here to help. And we're going to make sure that you get the medical device that you need today. Like that's what Care Chest is all about, and creating, a warm interaction with people who need it and really making effective interventions in people's lives as well.
Now, how many people do you think you would serve if you had unlimited resources?
So you said there's 60,000 people without insurance in Washoe County. And if 10% of those people, 20% of those people are getting hurt, having a surgery, facing a disability, something like that annually, that's another 6,000. It's a need that we see continuing to grow as more people in our community know about our services.
Okay, so it's not necessarily the circumstances surrounding the healthcare industry right now. It's that people are hearing about you more?
It's a confluence of factors. So we've seen the kinds of services we provide change as, say, the Medicaid expansion has rolled out, right? There are fewer low-income Nevadans who need assistance with prescriptions than there used to be. But we're serving more than double the number of people with medical equipment that we were 5 years ago. It's a need that continues to grow in the community. There are fewer people providing durable medical equipment to Medicare and Medicaid recipients than previously. And we're getting older. We're becoming a less healthy society as well, and more people need that kind of equipment than have in the past.
So is durable medical equipment your number one most requested thing?
It is. It is. It's our most popular program. It's also the program we were founded to provide. So we reuse medical equipment like walkers, wheelchairs, hospital beds. It's donated by the public. We would not be able to function without donations of equipment. So, if you have a walker laying around your house, if you have crutches from your last surgery or injury, something like that, we can get that to somebody who needs it. We sanitize it, we refurbish the equipment, and we put it into the hands of low-income Nevadans that are unable to afford it.
That's great that you don't have too many restrictive regulations where that's concerned too, because I know that can be an issue with reusing used items in the medical field.
That's right, and that's where we fit into it. We take on that task in order to connect a group of people that have equipment they don't need with a group of people that need it, pretty direly.
Is the need in northern Nevada particularly bad, or is this an issue across the country?
Nationwide, we know people have trouble obtaining health insurance today. We know that people have trouble paying for deductibles when they do have health insurance. We're unique in northern Nevada in terms of the services we provide. We're the only folks that do that. And if you need medical equipment and you're unable to afford it, it's the only place you can turn for a lot of the equipment that we provide. And that is a dire need and one that we see continuing to grow.
Do you have to turn a lot of people away?
It's rare that we do, and that's because of the generosity of the public. That's because people want to put their medical equipment to use again and help somebody. The number of times somebody has called up for a piece of specialized equipment, and do you have, one happened the other day, a standing frame, something to help a child with cerebral palsy stand, right? Pretty specialized piece of equipment. And we don't say, no, we don't have it. We go and look, right? We go and look in the warehouse, and sure enough, one had come in earlier that day.
Wow.
Yeah, and that's, you're doing the right thing when those circumstances keep lining up like that.
What do you hear from the people who really didn't expect to receive this kind of help?
I helped a woman a while ago who came into our facility to get a walker for her mother. And we like to show our clients other equipment that's available as well, because oftentimes, if you need a walker, you probably need help getting into the shower, for instance, right? And I showed this woman a transfer bench that allows somebody to safely scoot in and out of a standard tub. And she broke down crying, just in tears. And I asked her what's going on. I give her a hug, I say, what's going on? She says, I pulled my mother out of an abusive nursing home situation. She's been living with me for a couple months now, and my expectation was that she would never shower again. Right? And that's the kind of impact that we're able to make on people's lives. It brings people to tears. It brings our clients to volunteer. Our services are provided free of cost to our clients, but the number of people who try to make a contribution, who want to give back, give that dollar bill, give $5, give $10, that's touching and really starts to add up after a while.
It's hard to imagine anyone hearing about this and not wanting to help. So good opportunity for us to find out what you need from the public. What do you most need?
So CareChest would not function without donations of medical equipment. All of the stuff I've talked about, stuff like adult diapers, incontinence supplies, it's not, exciting to talk about, but it's a real big need for people. We also rely on volunteers to provide our services and have really great opportunities to do that as well. You get to change somebody's day and give them something that they really need when you volunteer with CareChest. And finally, we're a local charity. We are able to do what we do because of public support, because of normal people who have gone through something with someone they loved or have seen the impact that our services have on the community and are willing to contribute to making people's lives better. We have 2 fundraising events throughout the year. One is coming up on August 4th. It's Bacon, Bourbon, and Brews at Wingfield Park. It's the title says it all, kind of an unlimited samplings from local brewers and distillers, a silent auction, live music, just a fun Friday night. And the ability to, an opportunity to meet people who have similar interests and a good night out and supporting charity.
Yeah, sounds like a good time. I know Channel 2, we're active in that event as well, so absolutely encourage people to go out and support. We've got a little bit more than a minute left, and I do want to touch on who is able to contact you, how they qualify, and should they reach out even if they're not sure?
If you need help obtaining medical resources, medical supplies, a prescription, anything that we've touched on so far, please call us. Our phone number is 829-2273, or you can go to carechest.org. if we can't help you, we will know somebody who can and get you to the right place. But we are able to help low-income Nevadans with medical resources.
Okay, any final thoughts? Anything you'd like people to take away?
I just want to thank you for having us on and helping us share the message.
Okay, my pleasure. Thank you so much for everything you do and for taking the time today. All right, well, that is it for this episode of Face the State. But for more information on all of this, or to see past episodes, or to get links to donate, or to get more information on getting some help yourself, you can just head to our website. That's ktvn.com. Thank you so much for being with us. We'll see you next week.